The meeting today is Thursday, February 23rd. I want to ask all of us to please turn off our cell phones, or at least turn them to silent. Make sure they're off the table so we don't have feedback noise. You may notice board members accessing their laptops during the meeting. They are using that to access board meeting materials that are in electronic format. This is an official business meeting of the dental board. The board welcomes public comment on any item on the agenda, and it is the board's intent to ask for public comment prior to the board taking action on any agenda item. If for some reason I forget to ask for public comment on an agenda item and you wish to speak on the item, please raise your hand and you will be recognized. Depending on the number of people who would like to testify on a particular agenda item, a time limit may be imposed. We will ask all speakers to please stay on topic, and if a time limit is determined necessary, keep your comments within that time limit. I would now like to call the meeting to order and ask Dr. Wu to call roll.
Okay, Witcher,
Here.
Stewart. Here. Myself, and I'm here, Deborah Wu. Steve Alfred. Here. Fran Burton. She was here, okay. Steve Chan. Here. Yvette Chappelle Ingram. Here. Katie Dawson. Here. Judy Forsyth. Here. Kathleen King, not here. Ross Lai. Here. Hun Lei. Here. Meredith McKenzie, not here. And Steve Morrow. Here. Mr. President, we have a quorum.
Thank you. And I think, Karen, did you have a remark you want to make about timing and how we're handling the meeting
So good
today?
morning, everyone. Just a little explanation. We're trying something different this meeting. Closed session, board members, you'll see will be at the after, will be following the committees. We thought we would do that this time because primarily we have these meetings to conduct business and to allow the public to be able to comment. And our closed sessions were going so long in the morning that I was feeling a little uncomfortable that we were allowing the public to have to wait for the business to get started. So we're going to try and see how it goes. Also, hopefully, you will tie up your discussion. It's not a cue to go an all-nighter in closed session. So we'll see how that works and adjust appropriately. I think we'll get started. At some point, we'll take a lunch break, and we'll determine when that will be as we get through the agenda. And at this point, if I may, Dr. Witcher, I'd like to introduce some of our investigators that we have. So if Carlos will come to the mic here and have our investigators come forward. Of course, Patrick Morrissey is our supervising investigator from the Orange office. He's here with some of our newbies, and we have 3 of them. So, Carlos?
Good morning. Carlos Alvarez, your acting chief of enforcement. And so, like I said, I'd like to introduce the new investigators. And I know from previous meetings, we kept saying we're understaffed, and yes, we have proof, yes. Finally, we hired. So we have Caroline Montgomery. She has experience in investigations. She came from Division of Investigations and the Medical Board, so we welcome her. We have Key Gwynn, who also joined us from Division of Investigations and from the Medical Board. And we have Thomas Tortorici, who retired from the San Jose Police Department. So he's joining our enforcement team, so I'd like to welcome them to the dental board and welcome them to you, the members.
So, Carlos, don't tell them that their caseload is like 100 cases. Save that until a little bit. Let them pass probation and then give them the real scoop.
I was going to save that for the closed session.
Oh. Okay. Well, welcome to the team, and thank you. Board members, be aware of your mics when they're on, so the red light will come up when the mic is on. If you're not speaking, it's best to turn the mic off. That way it won't pick up any sidebar conversations that you might be having, and also we hopefully won't get the feedback that sometimes we get. So I think we're ready to get started.
Before we do, I'd just like, for the record, to note that Board Member Burton just joined the meeting. And I'll go ahead and give my president's report, and I will be brief. This is the first meeting of the year, and typically we will set some kind of direction for the year. as much as we can, although the board really is reactive to issues that come before us a lot of the time. As you recall from last year at our December meeting, we did adopt a board strategic plan. And so that is our reference document to guide us through the year. It's much more detailed than any previous one. This time we incorporated stakeholder input, and also staff were at our strategic planning session. So I think the strategic plan is kind of organized around the committee structure that we have, or maybe the other way around. So I would ask our committee chairs and committee members to kind of reflect on the strategic plan and how their task relates to the overall picture. Excuse me. The other major guidance document that we'll review at this meeting is in your agenda packet, and that's the Sunset Review paper. And, that's our to-do list from last Sunset Review, and we have that coming up again in 2019. Of course, we start the process the year before. So this year will be our opportunity to kind of go through and take a measure of where we are with tasks that we have been assigned. But not only that, but to be brainstorming about things that maybe we want to ask for during our next Sunset Review. And so those are kind of the two overarching things, in addition to all the issues that tend to come at us. So that's the overall framework. And I'd like to just start off by thanking all the committee chairs and committee members. It was actually quite a bit of work to figure it out, and a lot of people sent in specific requests and rank ordered them, and that was extremely helpful. And, I want to remind all the committee members that, of course, a lot of the committee work, such as developing background information and things like that, will fall to you. I mean, we'll provide, and Karen can speak to this, we'll provide staff support wherever and whenever we can, but we are a working board, and so the committees will play a large role in this. But again, I'd just like to thank you all in advance for filling in the gaps. Regarding my own activities, mainly it's been doing the committee appointments, preparing for this meeting, but I also had the privilege of representing the board at the Senate informational hearing on pediatric anesthesia. And we'll get a report on that later on today, and I won't go into a lot of detail. I know a lot of you were able to download and watch the webcast, and I thought it was a very well-conducted hearing. I thought they did a really good job, asked a lot of really good questions, very factual in nature and very penetrating, and hopefully we were able to provide some answers. It was a good exchange of information. And, I look forward to working in that environment as we go through the rest of the year. So that concludes my remarks, and thank you for your attention. So next, I'd like to move on with approval of the meeting minutes from December 1st and 2nd. And there were a number of changes that we noticed, and so we have passed out a revised copy of the minutes with the changes in red. And I would ask that you review that prior to hearing a motion for approval. And if there's anything that you see in there that we missed, please let us know. A lot of it was editorial type corrections, name spellings, things like that. And we just want to make sure that the record, it is a summary, it is an excerpt, it is not a transcript, but we would like them to be reflective of what occurred.
We're going to take just a few minutes. I know some of you had caught some things, so if you'll just check to see if we captured what you caught, that would be awesome. Also, after just a few minutes, I received an email yesterday from Dr. Siebert, who had some corrections to her comment. So I will read those to you, and if you're comfortable with that, we'll include those in these corrections. So we'll just take a few minutes to take a look through that.
Mr. President, I have some corrections or clarifications whenever we're ready on the note.
Have you gone through this? Okay. Let's have everybody just take a
Yeah,
minute, and then
sure.
we'll enter those. Thank you.
Sarah?
I'm sorry, if you'll just bear with us, Dr. Wu is preparing some changes here.
Well, actually, I can go through the changes that were emailed to me. So if you turn to page 9, the second full paragraph that starts out, Dr. Karen Siebert, she would like inserted, also representing the California Society of Anesthesiologists. So the sentence will say, Dr. Karen Siebert, also representing the California Society of Anesthesiologists, stated that CSA does not believe that the single, it will say now, operator anesthetist model is safe for pre-cooperative or uncooperative patients, adding an S, period. CSA recommends that there be a separate independent anesthesia provider for moderate sedation, deep sedation, and general anesthesia in pre-cooperative children or children of developmentally delayed age or known behavior disorder, period. The rest of the sentence remains the same. And we will, obviously, staff will be inserting this. If you go to page 11, again, Dr. Siebert commented that according to the medical model, physician anesthesiologists are not permitted to monitor a patient or supervise anesthesia if they are performing a procedure. I think she gave an example of an, can't read my own writing, but she gave an example. And if they are providing a procedure. Okay. And then the last sentence would stay the same. A separate anesthesia provider is necessary. And then Dr. Wu, you had some additional? Can you work off the copy we just?
Actually, it's all been corrected.
Oh,
Okay.
okay.
I have anything for later.
Oh, okay.
Okay, so everybody's had a chance to review the proposed changes. Are there any additional changes or corrections? Yes, Dr. Chan.
Can you repeat what you just said on page 11 of 21, where Dr. Siebert commented? What's being said, it doesn't make sense.
Okay, so this is the way this sentence should read. Dr. Siebert commented that according to the medical model, physician anesthesiologists are not permitted to monitor a patient or supervise anesthesia if they are performing a procedure. Oh, for example, an epidural placement.
Procedure, not administering anesthesia.
Right, for a procedure. So the sentence will, or the paragraph will now say, Dr. Siebert commented that according to the medical model, physician anesthesiologists are not permitted to monitor a patient or supervise anesthesia if they are performing a procedure, for example, an epidural placement, under general anesthesia or moderate sedation, period. A separate anesthesia provider is necessary.
Still doesn't make sense.
Is Dr. Siebert here?
No.
Apologies, my name is Vanessa Kahina, representing the California Society of Anesthesiologists. Dr. Seibert should be arriving in about 10 minutes, but I do have her statement with me and might be able to explain through it a bit more if you need.
Spencer, Dr. Seibert had sent this, she'd sent an email indicating what she wanted. If it needs further clarification, I'm
Can I explain what my confusion is? My confusion is that, oh, I'm sorry. My confusion is, I can understand where a physician anesthesiologist says not permitted to monitor a patient while they're performing a procedure. They're still the anesthesiologist. They still are responsible for monitoring. They may have a secondary person monitoring, but how can they not monitor when they've administered the drugs?
Hold on. The issue is whether or not this statement by Dr. Siebert is the statement that she made, whether or not it makes sense. So my recommendation is to table this.
Got it.
for- Until she gets here, and then we can revisit this. Just so you'll know exactly what the statement was.
Okay, so we'll table that item. Ms. Dawson, yes.
On page 12, starting with the fourth paragraph, Dr. Afriat asked for clarification regarding capnography. Dr. Witcher clarified what capnography is. I guess it's more of a grammatical error. Either you list what the capnography is, or you state that Dr. Witcher clarified or the definition of capnography.
Thank you, Katie. I recommend we say Mr. Afriat asked for clarification regarding capnography. Dr. Witcher clarified, period.
Okay, fair enough. Okay, so we're going to table this and move along here. Moving on to agenda item number 4, discussion and possible action to recall the August 18th and 19th, 2016, and October 13th, 2016 board minutes as requested by the American Academy of Pediatrics for the purpose of correcting the title of Dr. Paula Whiteman, Governing Board of the American Academy of Pediatrics. So those minutes with the corrections are in your binder, in your packet. Are there any questions regarding the changes?
My recommendation is to first have a motion to recall the August 18, 19, 2016, and October 13, 2016 board meeting minutes and set aside the approval of both.
So
In
moved.
mid-discussion.
Okay, so we'll need a motion to approve.
So moved.
Thank you. Okay, discussion. Are there any changes that anybody sees as being necessary, other than those requested?
My motion is to approve as corrected.
Okay, thank you. Any discussion? Any public comment? Okay, I guess we're ready to approve both sets of meeting minutes.
Okay. Witcher?
Aye.
Stewart?
Aye.
Wu, aye. Afriat?
Aye.
Burton? Chan?
Abstain. I wasn't there.
Chappelle Ingram? Katie Dawson? Forsythe?
Yes.
King, is not here. Lai?
Yes.
Lay? Aye. McKenzie, not here. Morrow?
Okay, that carries. Moving along, budget report. Item number 5.
Good morning. My name is Sarah Wallace. I'm the Assistant Executive Officer of the Dental Board. Today, before the board, you have the budget report for fiscal months 1 through 6, ending December 31st, 2016. The board has spent roughly $5.7 million of its total dentistry fund appropriation for this fiscal year. Of that, approximately $2.8 million of those expenditures were for personnel services, and $3.1 million were for operating expenses and equipment. For comparison purposes, we had spent approximately 49% of our budget last year, so we are on track right now. We've broken out the dentistry fund and then the dental assisting fund. The dental assisting fund through December 31st of 2016 has spent roughly $1 million, or 40% of its budget, for this year's appropriation. Of that amount, we've spent approximately $300,000 on personnel services and $750,000 for OE&E, which is operating expenses and equipment. We've also included copies of the expenditure reports with projections for the end of this fiscal year for both the dentistry fund and the dental assisting fund, as well as the fund conditions for both funds. And as you will see in those fund conditions, we are looking at fiscal insolvency for fiscal year 18-19, but we are going through a fee increase. These numbers do not reflect the proposed fee increase that is going through the approval process right now. We have also included the BREEZE expenditure updates for both funds, for dentistry fund and dental assisting fund, in your packets. And we've also included a breakout of what the Department of Consumer Affairs distributed costs are, what different categories we pay for, and what the distribution or the calculation of the methodology of how those amounts were calculated in your board meeting packets. And those are reflected, you'll find them under departmental services on the expenditure projection reports. So the OIS pro rata, admin, exec, interagency services, OPES, public affairs, and PPRD that are reflected on your expenditure reports. And I'd be happy to answer any questions that you might have.
Okay, any board member comments on the budget report? You know, I guess I would just comment that the distributed costs, that kind of grows out of something that came up at Sunset Review with the pro rata calculations. So this is, I guess, the department engaging in that issue. So I think we'll be hearing more about that. We pay a lot of money to the department, and there is some background information on how that cost is calculated, and it's interesting. And I think it's good they're going to take a look at it. So just kind of FYI. Okay, could I have a motion to approve, to accept the report?
We don't,
You typically don't do
we
that.
don't need to.
Oh, okay, fine, okay. Any public comment on the budget report?
Before we take public testimony, our board members, do you see the BREEZE costs? Did it answer questions that you've had in the past about them? Okay, thank you.
Hi, I'm Mary McCune with California Dental Association. I just had a-
Mary, your mic is not on.
Mary McCune with California Dental Association. So I just had a point of clarification. So in the general expenses for the dental board, it had a 367% overage, and I just wanted to clarify whether or not that was due to the BREEZE costs.
No, that would not be reflective of the BREEZE. That is a line item, and so we're looking into why that may be, but it could just be a miscoding error, and it should be perhaps on a different line.
Okay, cool, thank you.
Good catch.
And just to clarify for board members also, the budget stone, which is toward the middle of the page, this is something essentially for us to shoot for, but the way that these line items actually show up isn't in stone. We just have to make sure that we don't overspend. So typically, it is you do get a lot of information by going line to line, but the bottom line is the bottom right-hand corner. And so you just look to make sure that we're not overspending our appropriation.
Yeah, thank you for that. That term budget stone has always been a little opaque. So. Okay, moving along then, review of Dental Board of California Sunset Review issues identified during the 2015 legislative oversight hearings.
Okay. What I'm hoping to do is to start talking about Sunset Review. I know when we say Sunset Review, some of us cringe and say, how can it possibly be here again so quickly? But next year, we will be providing the legislature our background report already next year. Then the following year, as Dr. Witcher had said, in 2019 will be the sunset review hearings. Typically, we go through the items that were brought up at the previous sunset review. So there were 17 of them that we will need to address again next year. So I thought that this would be a good starting point for committee chairs to be looking at things that we will agendize in committees this year. And I'm going to briefly just go over some of these. Well, I'm going to actually hit on all 17. It's not going to take that long. But hopefully you've read them, and if you have any questions, we can briefly discuss it. But what I essentially was hoping that the board would do is this will remind us where we've been, and I'll give you an update on so far where we are in this process. Starting out with number one, obviously, we had legislation passed that allowed us to collect email addresses, and within my EO report tomorrow, I'll give you more specific information about how that's coming along, how many we've collected. But essentially, number one is complete, and staff will be reporting that. Number two is relating to the Dental Assisting Council. And I'd like everybody to take a close look at this. We've made a lot of progress since we had this discussion in Sunset Review, but I think that there are still loose ends that need to be tied up. You'll see that it references that an occupational analysis be done for registered dental assistants and EFs. That's been done. But I think that there'll need to be a more robust discussion moving forward this year in what we do with the practical examination, if we do anything, and essentially other issues that the Dental Assisting Council could and should be reviewing. So we will be agendizing this for a meeting of the Dental Assisting Council, and we'll look forward to see what kind of comments we can get relating to this section. I think we've kept the lines of communication open between the stakeholders involved, the board and the council. So again, we've started off, I think, aggressively addressing this issue. Later on in these 17, we'll talk a little bit more about the occupational analysis for both. That's already completed. Moving on to issue 3, the delayed implementation of BREEZE. This really is just going to be a staff comment. I will also address it tomorrow in my executive officer's report. We've been on BREEZE for about a year now, about 13 months, and the questions that had come up during that time really don't apply. So we'll just be giving a summary of what we feel our experience has been with the new computer system. Number 4 is the pro rata discussion that Dr. Witcher was mentioning. I think that we'll be bringing the pro rata study that the department had completed to the board, and we can talk about whether or not the board should, whether or not we'd receive cost savings if we backed out of some of the pro rata. I don't know that there's a lot of the elements of the pro rata that we could back off from. We currently do not pay into the Division of Investigation. But this is an issue that I think that we'll have to have more information to be able to respond next year in our report. Budget and staffing issues. This is one that we may be bringing to the board in May. Staff is going to be talking to our budget folks to determine whether or not it would be preferable to merge the dental fund with the dental assisting fund. I can tell you right now that the dental assisting fund does not really pay overhead. So they don't pay anything for me, they don't pay anything for administration, they don't pay anything for the building. So I think we need to look at that closely. I know that some board members have indicated or we've had a discussion in the past about subsidizing the dental assisting program. I don't think that that's necessarily where we need to go, but we will be working with the budget office to see what the pros and cons would be of combining both of the funds. So we'll be bringing this to you perhaps at the May meeting. Moving on to the licensing issues, of course, the foreign dental school approval process has been on our agenda for a while. We attempted to have legislation carried forth last year to take the board out of the foreign dental school approval process, and it didn't really go anywhere. So I think that we'll need to put this issue back out there, see how the board feels about that, and we'll be able to develop perhaps a stronger argument to see where it would go. Also remember that there's been a turnover at the legislature, and so there are a lot of new people. So it's challenging to deal with the turnover that occurs, but then it also gives us opportunities perhaps to have fresh eyes on an issue that hasn't been able to go anywhere in the past. So we'll see where we can go with that. Issue number 7 is the occupational analysis for the OA and the RDA-EFs and RDAs. That obviously is completed, so we'll report on that. Issue number 8, acceptance of additional regional examinations, is also in process. You will recall that a legislation was signed by the governor essentially that starts the process for the ADEX exam to be a pathway to licensure within California. An update on that is currently the budget is going through the legislature, and we would not be able to start to conduct our occupational analysis for dentistry until the budget is passed. The reason behind that is ADEX has, from the get-go, said that they are willing to pay for our costs to analyze the exam for the requirements of Business and Professions Code 139. And we actually had to get budget authority to be able to be reimbursed for that. So we sort of found that out at the last minute, fortunately. Had we started our occupational analysis already, we would have essentially been on the hook to pay for that and would not have been able to bill ADEX for that. So we anticipate after July 1st, which is the beginning of the fiscal year, that OPES will give us a schedule. We have a contract. We'll know what it's going to cost. ADEX has been in touch with us. They still are eager to pay for all of our expenses, so we'll be reporting on that. But essentially, 8 is in process. By the time we write our report next year, it is likely that we'll be halfway through with the process. And just to clarify, I know that some board members have had a question about what exam will the board be accepting, and the psychometric study will be on the ADEX exam, period. And the board has in the past said that they would like the exam to be the patient-centered exam, so then that will be done in regulation. So in essence, then, when we're done with this project, the pathway to licensure through ADEX will be for those students who have taken the ADEX exam, that's the patient-centered exam, not the other exam. Anybody have any questions about that? I know that it's kind of been a confusing.
Yes, so, okay, so I have a question. Okay, so when the occupational analysis is done, it will be done on the ADEX exam, not the curriculum integrated?
No, so the occupational analysis is unrelated to ADEX at all. So
Okay.
first, we're doing the occupational analysis.
Okay.
Then when Office of Professional Examinations goes in and does the psychometric view
Psychometric, yeah, okay.
of the ADEX exam, it's going to be what the ADEX exam is. So from what I've been told, there's no difference in the ADEX exam. It's just how it's administered. Okay? So the regional exam as it exists and this patient-centered exam according to psychometricians, is the same exam, it's just administered differently.
Just the format is different. Okay.
Yeah. So from the discussions the board has had in the past, and this will come up again, so I mean, from what I understand, that through regulation then, the board would say that it's the patient-centered exam which will be the pathway to licensure in California. Only. Okay?
Karen, I have a question, if I could. I believe that AB 2750 stated that the board could decide or choose which format that they would accept.
Right.
Has the board officially gone on record as choosing which one of those formats we will accept?
I'll have to go back and check the minutes. I think that, and we will have an opportunity to revisit this to be on the record, but I think my recollection is that the board was strongly leaning in the direction of only accepting a patient-centered exam.
Yeah, my concern is that we have a record of more than strongly leaning, but that we actually, somebody made a motion and it was discussed and approved,
Yeah.
that we accept the curriculum integrated or the patient-centered. Unfortunately, I would hope that all clinical exams are patient-centered rather than student or applicant-centered, but that, I think, is more descriptive of being a curriculum integrated examination rather than patient-centered. But I'm just concerned that we have a record that that the board has made a motion and approved that is the format that we will accept.
I think we'll have plenty of opportunity to address that as we go along the way in a number of different forums. And the final forum would be, obviously, the board initiates the reg package. It states there what the final requirement will be. So, yes, I believe that there will be a number of opportunities to put it on the record. You're welcome. And I apologize for using patient-centered rather than curriculum integrated. I know. Okay, patient notification of record keeping. This one came up during Sunset Review. It's issue number 9. We still have not really had many issues related to this. Why it came up in the past is that we had sort of a clustering of people leaving the country and abandoning patients. And we don't have it a lot, but this is an issue that the board may want to consider whether we want to seek legislation to essentially be more clear, perhaps prescriptive in if somebody sells a practice, what they should be doing. This really only comes up when we have a complaint filed. And so when a complaint is filed and we request the records, sometimes the dentist says, oh, I sold my practice. And then we go to the new owner and they say, we don't have the files. So it kind of can be a complicated issue, something that the board may want to discuss at a future meeting. Number 10, and we're almost done. We only have 7 short ones left. Unprofessional conduct, this one's done. CDA, you will remember there was a piece of legislation that essentially said that physicians were excluded from being charged with unprofessional conduct by treating a spouse or family member. And for some reason, dentists weren't excluded. So this is done. This is an issue. Essentially, if dentists are treating their spouses, they don't have to worry anymore about unprofessional conduct. Number 11, I think, is an issue we're going to punt to the Access to Care Committee and try to do some brainstorming as to whether the board should, whether or not we can identify whether there are shortages in certain areas. So we'll be talking with the chair of the Access to Care Committee and the committee to see whether we can brainstorm a response to that. Of course, issue number 12, Dental Corps Loan Repayment Program, was legislation that was passed last year. It became effective January 1st, and the staff is working on the plan to try to reboot our loan repayment program. We have $2 million that still can be distributed. I believe we only have one person in the program right now. So while we did do the overhaul, we will be reporting on whether or not we've been able to get more people involved in this program. Issue number 13, difficulty collecting citations. I believe we're showing improvement in this. We do not use the Franchise Tax Board Intercept program, though we do have it available to us. At this point, we are still gathering data from Breeze to determine what our outstanding what outstanding obligations are still out there. So we'll report this back at a future meeting. Number 14 is in process. This is continuing education. Essentially, we will need to put in a budget change proposal to request an additional staff person to start doing continuing education audits for our RDAs. Those budget change proposals within the next couple of months will be going in. Issue number 15, of course, is relating to our case management and time frame for our enforcement. And we've had, the last 2 years have been tough in terms of we've had a number of vacancies, and the folks that have not left us have done a wonderful job in trying to keep up with the caseload. We are very hopeful now that within the next year, we'll be able to crank out a lot of our caseloads, get our numbers down, and hopefully by the time we report to Sunset Review, we'll have a much better outcome in terms of what our timeframes are. Linda Schneider from the Attorney General's office will be here tomorrow morning, and she's going to give an update essentially about how she and I have been working together to decrease the timelines. So we'll look forward to her report tomorrow. We should also ask her at that point whether or not they received more positions and whether more positions were allocated to the administrative law judges. Issue number 16 is regarding enforcement staffing issues. We have in our strategic plan, and I know that Dr. Stewart, as Vice President, is responsible for spearheading our strategic plan moving forward. We're going to be having a conversation about this particular issue, because in the strategic plan, I believe we've talked about having an audit of our enforcement program to see how we're doing, whether we need more people, and if we need more people, at what level are we talking? Special investigator? Are we talking sworn investigator? So this is something that we will be bringing back to the board. We have started planning the subject matter expert training, and we hope to have that out there within the next couple of months. Also recruiting subject matter experts. We will be looking also at what we pay subject matter experts, and what we pay them is pretty much in line with what the medical board pays, and so we'll be reporting back on that. Lastly is an issue, number 17 is an issue that I'm not sure whether we can really ever move forward, and I've talked about this before. Typically when I have a good experience somewhere, they always say, oh, please fill out the survey and tell us how much you loved it, and I don't do it, unfortunately. So most of our consumer satisfaction are dissatisfaction that we received, and typically it's related to we couldn't get their money back for them, the timelines take too long. So of course, if we can get our timeline shortened, we would hope that we could improve what the satisfaction level is among people who file complaints with the board. So we'll continue to work on that. So thank you for indulging me to start the year off by saying this essentially is the agenda for the year. And of course, we'll fit the more time-sensitive issues within board meetings around these things. But I'm again asking the chairs of the committees to take a look at this, and we'll be contacting you to see how to agendize some of the discussions, what kind of background we'll need to get a robust discussion starting. So it's going to be a busy year, so go down to the mall and get some running shoes. And does anybody have any questions? Awesome.
If I could offer a comment, I think the committee chairs shouldn't be too concerned because due to all the activity since Sunset Review, we've got a much shorter list than we started with. It's really not too bad. But that's the challenge is now we got to come up with things that we would like to see changed, which I think is always a little harder.
Yeah, I think we had 28 issues, the Sunset Review before the last one.
Yeah,
So
right.
we did cut it down. So it's all good.
And some are recurring themes like enforcement timeframes. That's been around for a long time. Okay, any public comment on that agenda item? Please, come forward.
It's not on.
Oh, there we go. Hi, Tony Lum with the Dental Hygiene Committee. I just wanted to point out in my agenda, I have an 18th item. I just didn't want you to overlook that. I don't know if that's right or not.
The 18th item is,
It says over here, continued regulations
Oh.
by the board.
that just means we get
Okay.
reappointed.
Okay, I just want to point that out then.
Yeah, I don't think we'd get a lot of discussion about that unless one of our board members said, I'm done, we don't want the board to exist anymore.
Good point.
Thank you, Tony.
Okay, if there's no public comment, I'd like to move on to the next item, number 7, our enforcement report.
Hi, good morning. Carlos Alvarez, Acting Chief of Enforcement. And I will be going over the review and enforcement statistics and trends. And in the beginning, I have here that we have charts for everybody to review as we go along, and I have charts 1 through 3. And I'll apologize ahead of time. We don't have a chart 2. Chart 1, for some reason, was copied twice, so I apologize. But we will get chart 2 out to everyone after the meeting, so everybody could review it, so I'll apologize ahead of time. So what we'll be covering is the Enforcement Division. We have on the charts for the last 5 fiscal years and quarters 1 and 2. So the last meeting that we had, quarter 1 was not in there because some of the codes that Breeze was going through was changing, so we couldn't do it. So our staff was able to put it in with quarter 2 that I'm going to be going over with. And so quarter 2 covers from October 1st, 2016 through December 31st of 2016. And I want to go over what complaints received. And again, this is on chart 1 if anybody wants to review it. So the total number of complaints received during the first quarter was 797, averaging 266 complaints per month. And an active caseload of 1,287. And the average caseload for consumer services analysts during the second quarter was 249 complaints. It's an increase from 201 in the first quarter. And I cover complaint aging. So one of the things I want to cover with complaint aging, what this kind of means that there is some type of hold on the complaints, because there is times that we receive complaints and there isn't a signed authorization from the patients, so where we can retrieve records. So therefore, we send it out, and sometimes there is a delay from the patients returning that form. And then sometimes there is a delay when we do have it, but there's a delay of retrieving the records, and sometimes we don't have cooperation. So I just want to cover that with the complaint aging, where it covers some. And then there's some cases where it's with the consultant. So there's kind of like a holding pattern there, but they are being actively worked on. So with 0 to 3 months with the cases for quarter 2, there's 442, which counts for 34%. 46 months for quarter two was 402, and that counts for 31%. 7 to 9 months, there's 264 cases there, which counts for 21%. 10 to 12 months, cases are 139, which counts for 11%. And for 1 to 3 years, the cases are 40, which counts for 3%, which comes out to 1,287. And again, with the 1 to 3 years, we've really been working on these. And because, again, there is, and I want to assure you, it doesn't reach the 3-year mark. I can assure you that that doesn't reach that mark. We are working it, and like I said, it's because sometimes we don't get the cooperation. So we have to move on with subpoenas and everything in order to get those records. But we've really been moving on these because we don't want to have the case aging, or we want to miss the statute. So we really work on these cases that from the 1 to 3 year mark, because like, again, we don't want to lose those cases, and they're still important for us to investigate.
Carlos, can I ask you a question?
Sure.
On case aging? That has, for as long as I've been on the board, has been an issue that comes up in sunset review. Is there a way to start quantifying that, to keep statistics on how many cases are aging because you're waiting for records, or how many cases are waiting because there is some other prosecution, or whatever the reason is? It's something that I've never been satisfied with, and I don't think that anybody else has been. It's like, yeah, we've heard that. That's what we hear, but can we actually see that? Is
Yeah.
there something that we can do so we can see?
Yes, we have, because now, since we have a manager now in CCU, because that position was kind of vacant for a while, so the new manager came in, and we've been starting to have that on the spreadsheets now, keeping statistics on it. And like I said, so we did identify that issue, and with the managers, we did have meetings to clarify this, and that's why we started really working on these. We started having meetings, we started having training with the unit, CCU unit, with the complaint compliance unit, so they learned how to do subpoenas, because they weren't trained in it. So that was one of the things that we did, was we had the meetings with all the managers, we trained the analysts how to write subpoenas so we could get this, so we could drop these cases down that were aging, because again, we didn't want to lose them in stats, and they're still important for us to investigate it. So like I said, we had the training, and we're identifying this, and that's why we're kind of starting to work backwards. So we sit down, we had a meeting with the managers, and we started reviewing these records as well, because we didn't want to miss anything. So we started reviewing it to have a second set of eyes and to find a way so we could move it on where we don't have to wait. Again, one of the things I said was to get that sign authorization. So if there's a way we can move it to an investigator to move the process faster, we're doing that. So we've been identifying it.
Carlos,
Yes.
there's a lot of moving parts. There's a lot of benchmarks in the processes, and then each of these are a snapshot in time. And I'm going to ask this anyway, is it possible to consider graphically showing the aging of these cases, or the numbers of cases, rather than just numbers? The second one is to look at graphically showing the trend analysis. Those will jump out at you. When you see the graphic numbers of cases at each benchmark,
Yes.
it'll show us better than just seeing the numbers. Is that a fair request to ask?
No, I mean, we can do that. We could provide that. It's like we go back and like I said, we could sit down with the managers and everything, so we could provide that to you. So like I said, so to get a better understanding, then yes, that would be something we'd go back and work on so we could provide
you.
that. Like I
Thanks.
said, so yeah, some graphs work better than, like you said, just numbers.
Any other questions? Could you just clarify, maybe for some of our newer members, what you mean by the statutory limitation on cases?
Yes, because once there's times where they had some treatment, they had some problems, and let's just say they don't find out about it until they go see another dentist. So they might have said, yes, I have a complaint, and this was back in 2010. So therefore, by the time, well, the way the statute reads is we have 3 years from the time that it occurred. But we also have 7 years until it's discovered by the dental board. So that's why when I explained about the case aging and the stats, that's what I mean, is because of the Business of Professions Code. So there is times that patients don't realize that they had some bad dental treatment years until 2, 3, 4 years down the road. They find out, oh, I had some bad procedures done on me, and that's when they report it to us. And so that's where it comes into, we're dealing with the stats, that we don't want to expire the stats on that.
That clear? Okay, thank you for that. Any other comments from board members? Any questions from the public? Okay, seeing none, thank you. It was very informative and appreciate all the hard work and your unit on this. We know it's been a challenge, and we're hoping now that staffing is back up, that it gets a little easier for everybody and maybe we make a little bit more progress.
Yes, thank you very much. And there's still some stats here to provide. I still have performance measures and advisory and program report to cover.
Good, thank you. Now, I understand, I'm sorry?
Wait, what he just said was, we only got through A.
Oh, okay, sorry, let's continue then.
Okay. I'll be glad to wrap it up right now, too.
Okay.
Oh, you're not going to get off the hook that easy.
Just being honest. So I'll go back with cases closed. Is the total number of complaint cases closed between October 1st, 2016 and December 31st of 2016 was 576, averaging 192 per month. So the previous 5 years averaging was 203 closures per month. And again, I apologize because I said refer to chart 2. We don't have chart 2. So the average number of days a complaint took to close within this quarter was 112 days. So we dropped down to investigations to current open case closed. So as of December 31st, 2016, there was 853 open investigative cases and 62 open inspection cases. For the second quarter, the average caseload per investigator was 39, with 41 for special investigators and 44 for enforcement analysts. So we break down to months again, and so 0-3 months, the case volume is 39, which accounts for 5%. 4 to 6 months, it's 55 cases, which counts for 6%. 6 to 12 months, it's 130 cases, and which accounts for 15%. So we have 1 to 2 years, we have 401, which counts for 47%. 2 to 3 years, we have 173, and that counts for 20%. And 2 to 3 years, it's 55, with the percentage of 6%, which comes out to 100%. So since our last report in December 2016, the number of cases aged 6 to 12 months have decreased by 5%, while the number of cases over 3 years old have slightly increased by 3%. And again, we've really been working on the case aging. So I think we did a good job there as it kind of dropped. So cases closures, total number of investigations closed with the Attorney General's office or filed with the district attorney, city attorney during the second quarter was 287 cases. This represents an average of approximately 96 cases per month, and there was an increase by 13 cases compared to the first quarter average of 83. And the average number of days an investigation took to complete the investigation during the second quarter was 370 days. And this is a decrease from the average of the last fiscal years of 378. And cases referred to discipline, there are 273 open probation cases. The total number of cases referred to Attorney General's office during the second quarter was 57, with an average of 19 per month. And the 3-month average for disciplinary cases to be completed was 1,096 days. And again, I apologize for referring to chart 2. And chart 3 provides a number of type of allegations made for all the complaints received and their corresponding percentages for the second quarter. So I'd like to move on to the review of fiscal year 2016, 2017 for the first quarter performance measures from the Department of Consumer Affairs. And this covers July 2016 to September 2016. And so second quarter performance measures are not completed, and we're still waiting on the date from the Department of Consumer Affairs to come out with a date when that would be completed. So the enforcement performance measures for quarter one, and that's July 2016 through September of 2016. Number of complaints and convictions received. So in July was 350, August was 347, then it dropped down from September, it dropped down to 295. So total received was 992, and monthly average was 331. So there was complaints 872, and there was 120 convictions. So intake volume, number of complaints. Yes,
Carlos, I'm sorry, before you go for it. So when you say 120 convictions, what do you mean?
What I mean is 120 convictions. So when we receive the complaints, we also get where it comes from any licensee who's been convicted or arrested. We get the from Department of Justice, since they've been fingerprinted, we find out about those. If they've ever been arrested, if they've been arrested, we get those allegations and we open up complaints on them. So that's from any licensee that we have with the dental board.
So just to clarify for board members, so within these 3 months, we received essentially 120 notifications of convictions on licensees, both RDA and dental assistant, RDA and dentists.
So notifications is that they were arrested, then we get notifications that there was a conviction. So we start working on those as well immediately, once we get notification.
Those are considered, I mean, we open a case, but we also call it essentially a complaint that's open. So that's why they're separated out now.
And so that may have been with or without a notification from the dental professional, right?
Correct, because they have 30 days to report it. I mean, after the conviction, they have 30 days. And some might know, some might not know. It depends from the advice that they get, that they have 30 days to report it. So the percentages are small that we do receive notification from the licensee. And I'll go into intake volume as I was covering. So number of complaints closed or assigned to an investigator. July was 392. August was 337. September was 302. So total amount is 1,031, and the monthly average was 344. And the intake cycle time, the average number of days from the complaint received to the date the complaint was closed or assigned to an investigator. So that's when everything comes into the complaint compliance unit, they open it up, and then they move it on to an investigator, or they keep it there and to notify the people that we did receive their complaints. The target date is 10 days, and we've been doing that in 4 days, so we've been doing a good job on that. So investigation volume, number of investigations closed, and this is not including cases transmitted to the Attorney General. So with these here, when we close these cases, that means we didn't find any evidence of any type of violations from the Dental Practice Act. So for July was 365, August was 257, and September was 228. So the total amount is 850, and the monthly average is 283. In investigation cycle
All right,
time.
Carlos?
Yes, I'm sorry.
Before you go on, for the board's clarification, the number of investigations closed, what's happened to this point? Why don't you explain the process of what's happened to this point before it's closed?
So with these, some are that move on to investigations. The complaint might be criminal. Some might be the quality of care that we get. And so when we move on, we didn't have any evidence that any criminal activity had occurred, and we gathered all the evidence, and we move it on to an expert or to a dental consultant. They review it. So like say this talk about fraud, so they review all the patient records and everything. They'll note that there isn't any type of fraud. So therefore, we'll close out the case. And then some of the cases too, we'll give it to a dental expert to say, yes, no, there wasn't any negligent treatment, there was no repeated acts of negligence, and we'll close it then there. And that's when it doesn't move on to the Attorney General's office, because there's just isn't any violations of the Dental Practice Act at all, any criminal or negligence.
So I just want board members to know that essentially a full investigation is completed. So the investigation is completed and it has gone to an expert for review.
Yeah, yeah.
And at that point, then it's determined. So a lot of work is still going into it, even though it does not go on to the Attorney General's office.
Yeah. And if it doesn't go to an expert, it'll go to the District Attorney's office, and they'll also get in, they'll say, no, we don't have a crime here. And simply they'll tell us, and we'll close it out. So we also get that an opinion from the District Attorney's office. If we think that there's any criminal activity, we'll give it to them, they'll review it, and they'll come back and say, no, you don't have anything, and we'll close it at that time.
What we're also looking at this point is whether or not a violation has occurred that could be addressed with a citation, rather than taking it further to an accusation. Okay, thank you, Carlos.
I have a question. So who enforces the citation and the collections of fines? If it doesn't go that far, how do we collect those fines? So is there a department that does enforcement do that?
Yes, we collect the fines. So when a citation is issued, there's a certain amount of time in which the citation needs to be paid. If the citation is, if the person asks for a payment plan, we try to put one together as quickly as possible, but typically they're asked to pay within 90 days. I don't recall exactly what the time frame is. If they don't pay, we put a hold on their license, and if they continue to not pay, we can actually go to the Attorney General's office. So we collect the money. Staff collects the money.
So is it pretty effective, or are we having trouble? Like, I find that we don't collect a lot on even cases that have been completed.
Right.
And through AG's office.
It's a little different because essentially the citation stands, and we'll come back with a report to the May meeting of how we're doing with our collection of citations. With regard to comparing that to cost recovery for the discipline that actually goes to the AG's office, you're right. There's a lot of moving parts within that. So when I go into a stipulated settlement discussion, what I'm looking for, if, say, an ALJ is requesting that we decrease our costs, I try to make sure that we at least cover our costs. So there are typically at least 3 parts to a billing for an accusation, and that's the Attorney General's office, our investigative costs by our in-house staff, and then subject matter expert costs. So what I try to retrieve essentially is at least the Attorney General costs and the subject matter expert costs, because our staff is paid staff. So sometimes we let the investigative costs go.
So is there a standard level that's compared to whatever violation they have? I mean, just like if there's a parking ticket, you park in the red zone.
Oh.
I mean, is there a minimum, maximum to
Oh.
each violation?
Thank you for bringing that up. That is for a discussion for the May meeting. For citations, we're going to be asking the board to consider putting just that into regulations so people can see, gee, I had a citation for this, and it would give a minimum and a maximum. That's what you're asking? Yes. Right now, it's discretionary, and in my head, I've got a minimum and maximum, but if I wrote that down on paper, it would be an underground reg, so we're not doing that.
Okay.
But Thank you for bringing that up, because yes, that's on our radar. We actually were going to bring it to this meeting, and we thought, well, the citation fine project probably needs to be a whole presentation from start to finish about what the program is and how we do that. But staff will be coming forward with a recommendation to put the range of citations in regulations so everybody can see where we're going with that.
Because now in the business professional codes, it does have a minimum and a maximum. It does have that there. And a lot of times how we consider it is how many complaints does this licensee have, the seriousness of it, and sometimes that's how we come up with the fine amount. Is we do look at everything there, how many complaints they have, or if it's just the very first time that they received a complaint, and also from the dental consultant, what they consulted on it as well.
I think that's a perfect opportunity for a citation fine to use that. It's a little more complicated within an accusation that goes to the AG's office because the costs are constantly changing. So, thank you.
So, two different questions. Question number one, this is a snapshot in time again, and just coming onto the board, it doesn't really tell us from year to year, are we doing better? Are there shortfalls that we need to work on? So would that be helpful for us board members to see from year to year, comparing from year to year, or like a 3-year trend? So that's the first question. The second question is a question about fraud. I can think of two different kinds of fraud, the insurance fraud, and then there's fraudulent practices where you promise to do something and you do something else, which is probably unprofessional conduct. Once the case is closed and a settlement is reached here, what happens to the case? Does it go forward to like the AG for investigation? Does it go to the insurance company for determining whether or not there was fraud with the insurance companies? And does it require our staff to continue on to that beyond the case itself?
Could I just interject here?
Sure.
Those are really good questions, and I think you can work with staff to get them answered.
Okay.
In interest of time, I'd like to
Got
bring
it.
us back and stay concentrating on the report.
Okay, thank you.
Thank you. So I'll move on to investigation cycle time. The average number of days to complete the entire enforcement process for cases not transmitted to the Attorney General. This includes intake and investigation. Then we'll get back, and it'll probably include citations as well. So the average day is 270 days, and the actual average days is 178 days. So we've been below this target where we actually been actively working on these cases. And formal discipline, the volume, caseload, and those transmitted to the Attorney General's office. So in July, we had 3, August, we had 16, and September, we had 19. So it was a total of 38, and monthly average was 13. So these were cases that actually went to the Attorney General's office. Then for formal discipline cycle time, the average number of days to complete the entire enforcement process for cases transmitted to the Attorney General. This includes intake, investigation, and transmittal outcome. So the target average day is 540, and the actual average is 838 days. And then, like Karen said, she's been working with the Attorney General's office, Linda Schneider. So hopefully, we're going to bring down these numbers and identify where kind of that holdup is at, and see if they could also move on these cases quicker as well. So we're working on that. So then we're moving on to probation intake, and these are the number of new probation cases. So in July, we had 5, August, we had 1, and September, we had 8. So a total number of 14. So probation intake cycle time, this is the average number of days from the monitor assigned to the date the monitor first made contact with the probationer. So the average, the target is 10 days, and the actual average day here was 15 days. And with this one here, I kind of did some research because in the past, we've been on the target dates, we've been below, and we just haven't been getting some cooperation from just a small percentage of the probationers. Some didn't understand we get that they didn't understand the probation when they signed it, and they're confused on it, even though they had some advice and they signed it, they're still confused on it. Some were on vacation at that time and didn't realize that they had to be contacted before those days. So that's why on this one, we had kind of 15 days. It's just some of those instances that we've been occurring. So for probation violations response, number of probation violation cases, we didn't have any for probation violations this quarter. And also for probation violations response cycle time, we didn't have any for this quarter to report. So I'll move on to diversion program report and statistics. So the diversion program statistics for the quarter ending December 31st, 2016 are provided below. And these are statistics that are derived from Maximus. So as you see that self-referrals, enforcement referrals, probation referrals, we didn't have any. It was all 0. So probation referral for October, we had 1. For November, we have 2. In December, we had 0. So cases closed, we only had 1 in November. So active participants, as you see, and it kind of dropped and it went kind of back up just by 1. So in November, we had 23, and December, we had 22. So currently, right now, the board is currently recruiting for a public member for the position in the Northern California Diversion Evaluation Committee, and a dental position on the Southern California DEC, and also dental auxiliary positions for both Northern and Southern California. And so for the next diversion meeting is scheduled for March 9th, 2017 in Northern California.
Our diversion numbers have really dropped off. At one point, there were close to 100 people in the diversion program, and from what I understand, part of the reason is with the uniform standards being implemented, the number of required tests is phenomenally high, and to have a test is very expensive. So we're thinking that's part of why people aren't self-referring to the program.
Yeah, you can see that nearly all the referrals have been either probation or enforcement referrals, and that people don't voluntarily go in. I would speculate that they go into treatment outside the diversion program and try to deal with it that way. But that's just speculation.
Okay.
Thank you.
Thank you very much.
Very good. Okay,
Public comment.
any public comment on the enforcement report?
Zhang Yudeling. I represent the Daggers and CDA. Well, I'm a member of those organizations, but I would like to know, I know that he asked Dr. Chan asked the question about what happens to the person who had to pay the fine. And I would like to know, is that going to be made public somewhere, his question? The process of, so somebody gets fined and then they pay the fine, and then what happens to them afterwards? Do they go to the insurance? Then do they have to be, go to the insurance, or do they have to get the things processed through the insurance and be accountable to the insurance company when they've done something wrong? I'm sorry. I don't know if I'm making
Zania,
sense.
I think that we'll have this discussion. It's not agendized to go
Okay.
into that. So we can have that discussion outside the meeting,
Oh,
and we'll
okay.
try to clarify the question.
Okay.
Okay?
Yeah, there are some procedural things that are a little bit difficult to follow, and so we'll try to get you that information. Okay, so seeing no public comment on our enforcement report, I'd like to go back to the minutes. And we had a question, Dr. Seibert had requested some changes, and we just wanted those clarified since she's here. And there is a corrected copy of the minutes but I think you had some other corrections that you wanted added, so we'd like to do that.
We did correct that, and you need to put your microphone on. There you go.
Okay.
Okay, so your name has been corrected. The particular paragraph I read into the record, one of our board members wanted clarification. So the particular paragraph that you sent me recently, it says, Dr. Seibert commented that according to the medical model, physician anesthesiologists are not permitted to monitor a patient or supervise anesthesia if they are performing a procedure, for example, an epidural placement, under general anesthesia or moderate sedation, period. A separate anesthesia provider is necessary. Dr. Chan, you had a question.
The statement itself doesn't make sense because I can understand where in the model, a separate anesthesia provider is required in that model. But then it says that the physician anesthesiologist is not permitted to monitor the patient.
Excuse me, Dr. Chan. Since this was a statement that was made during public comment,
Yes.
the statement does not necessarily have to be accurate. The minutes just have to reflect what the statement was.
Is that an accurate statement?
The point is that we are not permitted to give sedation or anesthesia to a patient at the same time we are performing a procedure on the patient. So this would apply, for example, to pain management anesthesiologists who do interventional pain procedures, epidural, steroid injections, intrathecal pump insertions, things like that. They're actually performing a specific procedure, and they're not allowed to monitor or supervise the sedation or the general anesthesia provided to that patient at the same time. There has to be a completely separate licensed CMS qualified anesthesia provider dealing with the sedation or the general anesthesia while the pain specialist is performing the operation.
That makes sense.
Okay. If there's a way to phrase it in the minutes so that it's more clear.
No, there isn't.
Okay.
It has to be the statement that you made at that time.
And that
and not
was
a new
it.
statement.
Mm-hmm.
So the statement that the executive officer read, is that a correct statement?
Yes.
That's the one you said. Thank you. So
Mr. President?
Thanks for that.
I move that the minutes be adopted as corrected.
Okay, any public comment? Okay, let's have the vote. Yes?
Stewart? Yes. Wu, yes. Afriat?
Aye.
Burton? Chan? Chappell Ingram? Dawson? Forsythe?
Yes.
Lai?
Yes.
Lay? Morrow? We have a quorum. You good? Yes.
Okay, thank you. Okay, so that concludes this portion of the agenda. We're ready to convene the joint meeting of the Dental Board and the Dental Assisting Council. I think we'll take this opportunity to take a 5-minute break. And after the break, please come back and we'll go right ahead with the joint meeting. Thank you. Are we good? Okay, I'd like to go ahead and call the meeting to order. This is the meeting of the joint meeting of the Dental Assisting Council and the Dental Board. And we could have the secretary call the roll, please.
Okay. Good morning. Emma Ramos here. Ann Contreras.
Here.
Pamela Davis.
Here.
Tamara McNeely.
Here.
Jennifer Rodriguez.
Here.
Stephen Chan.
Here.
Judith Forsythe.
Here.
Ross Lay.
Lie.
Lay. Sorry.
Let's get started again, huh? I'm here.
I'm so sorry.
Okay. I never did that. Yeah, that's true.
Oh. I'm so sorry. Is that it? I'm done. Oh, we have a quorum.
Thank you. Okay. Okay, approval of the meeting minutes. Everybody had a chance to review those? Could I have a motion to approve the minutes? Okay. Any comments from the public? Seeing none, Dr. Wu, could you call the roll on that vote?
Witcher,
Here?
Stewart. Wu, here.
Yes, we're saying yes.
No.
Yes.
Okay, should I start again? No, kidding. Afriat. Thank you. Okay. Burton. Chan. Chappelle Ingram. Dawson. Forsythe. Lai. Lay. Morrow. We have a quorum, Mr. President. For the vote.
Okay, thank you. Okay, the minutes are approved. Moving along, dental assisting staff update.
Wait, Spencer?
Yes.
Doesn't the dental assisting?
The council hasn't voted on the minutes.
We're reconvening. Do we need to call roll again?
No, not, no.
No, we just voted on the minutes of the joint meeting, but the council didn't vote yet.
Oh, okay, sorry.
Yes, that's correct.
Okay, so we're doing the vote.
Okay, Ann Quinteros? Aye. Emily Ramos, aye. Pamela Davis? Yes. Tamara McNeely? Yes. Jennifer Rodriguez? Yes. Stephen Chan?
Yes.
Judith Forsythe?
Yes, we already voted, so we don't vote again.
That's
You
correct.
don't vote again?
You do not.
I don't know, it's on here.
The way it has
So
been
he's not-
previously been done is that the
Stephen's
person,
Not here?
He's not on the board.
Okay, we got,
Yep.
so I'm thinking that somehow our record is Dr. Lai should be on the council, not Dr. Chan. Were you
Dr. Lai.
confused? I was
that's right.
confused.
So these guys were crossing out then,
He's
right?
okay with it, but,
Stay, I can leave, that's fine.
So are we crossing it because they already voted?
okay. So just for clarification, the roll call sheet apparently said Dr. Chan was on the dental assisting council. It should have been Dr. Lai. I think we have that corrected now.
Yeah, but you already.
And you didn't say a word sitting right next to her.
You're supposed to be my bud, come on.
Okay. Okay, why don't you go ahead, Sarah? You're on.
Good morning. Sarah Wallace, Assistant Executive Officer for the board. Since the last meeting, we've had a lot going on in the dental assisting unit. We've filled several vacancies, including our AGPA for the Educational Program and Course Coordinator. We've filled it with Laura Fisher, who is a longtime board employee and has previous dental assisting experience. We've also been able to hire a new AGPA in the examination coordinator position, and that was Tina Valerie was hired. Tina is also a longtime dental board employee, previously running the portfolio program for us as well, and she also has previous dental assisting experience as well. We've also hired 2 new staff to the unit. Jessica Nguyen was hired as a new management services technician. So she is in charge of, along with Crystal and Ricky, reviewing applications and coordination of the administrative functions of our examinations. And we've also hired Karima Bassa as our new front counter staff. The board has administered RDA practical examinations in January and February in Pomona and San Francisco, as well as an RDA EF examination at the end of January in San Francisco. Doctors Lai and Wu were able to attend the administration of the EF examination on January 28th at UCSF, and Dr. Wu was also able to attend to observe the RDA practical examination on February 11th at UCSF. We've also been working with the DCA Office of Professional Examination Services, and I'll report a little bit more on this and later on in the report, the other reports. Essentially, we've been scheduling subject matter experts for several of the workshops that OPES has been putting on for the RDA practical examination review and the combining of the law and ethics and the written examinations for the RDAs. And we've also received notice that we will actually be losing another staff person, so we'll be filling that vacancy here very soon. Crystal Heyer just accepted a promotion to another agency, and so she'll be leaving us in March, and we will be looking at filling that vacancy as soon as possible as well. And I'd be happy to answer any questions you have.
Okay, seeing no questions, can we go ahead and continue?
For the update on dental assisting program and course application statistics, we provide a calendar year update. Since the beginning of 2017, we've received 5 applications for different programs and courses. The statistical breakdown is included in your board member packet. I'd be happy to answer any questions you have. Now that we have 2 AGPAs working on the educational programs and courses, of course, you also know Leslie Compaz, who's been working on the educational program and course regulations development, but we're also working on the recruitment of additional subject matter experts for the site evaluations and course and curriculum review.
Okay, any questions on that agenda item?
Mr. President?
Yeah.
Sir, I have a question. Once a dental assisting program has been approved by the board, is that program ever reapproved? Do we have a process whereby we look at maybe the outcomes assessment of that program, and do we do a reapproval?
Right now, we currently, for the initial approval, there's a provisional approval, and then after the first graduating class has gone through, then they can become fully approved. There is a requirement for reevaluation every 7 years, at minimum. However, we can reevaluate as needed, and we're currently working on a schedule to reevaluate all of those programs right now to bring us up to current status.
Okay, so we do have a 7-year reapproval cycle?
Correct.
Of all programs and courses as well?
Yes. Now, the reapproval may not necessarily require a site evaluation. It may just be that the program or course is required to complete another curriculum review, essentially re-complete their application, and we would review that and then determine at that time whether or not a site evaluation is necessary.
Okay, thank you.
Anybody else? Okay, thank you. Continue.
So next we have the update on dental assisting examination statistics, and I'd like, this is current for 2016. We're still pulling the data for 2017. I would like to point out, and I think I pointed this out at the last meeting as well, speaking with my staff, we had encountered some issues when we were pulling this data, where a lot of the data from the reporting system we found later on had been duplicated unintentionally. And so the cleanup, we're in the process of cleaning that up. So I can't verify the 100% accuracy of these statistics, but we are working on cleaning those up, and we'll be posting them on the board's website as soon as possible. These also do not include the breakout of the OJT and education. Again, that is something that we're working on with our information services office to be able to extract that data from our reporting.
Sarah, is
program.
this duplication a consequence of Breeze?
Yes.
Okay.
It's a Qbert reporting is what it's called, and we've been encountering issues over the last few months with this, and you'll also see in the licensing statistics where we've found duplication. We've submitted tickets to have it corrected, but I don't have an ETA on when that's going to.
Okay, so
be
just for
resolved.
clarification, because the statistics are off because of the reporting process, not necessarily what we've inputted into the system, but how we're able to pull that information out. The Qbert system that Sarah's referring to is essentially a reporting system that integrates with Breeze. All boards use it. So when one board makes a tweak to the system, sometimes it knocks another board into some sort of a challenge. So we go back and forth like this often. So we'll report back if anything
Yes.
changes.
Yes.
Okay, seeing no questions, we can continue.
I have one question.
Mhm.
So, the RDA EF and the orthodontic assistant and dental sedation assistant, do they have different tests?
Yes,
Oh,
they have
yeah,
separate
yeah,
written
yeah.
examinations.
Totally different programs. Yeah,
Different exams.
And they're all given independently?
Yes.
yeah.
They're computer-based tests for the written examination administered
It's
by,
just the written, there's no practical?
no practical for the orthodontic assistant or the dental sedation assistant.
Okay,
So an update on the dental assisting licensure statistics. We've tried to expand the data that we are showing to replicate what we were able to create for the dental licensing statistics back at the December board meeting. And so, again, Hubert has not been 100% reliable. So if you see discrepancies between the last statistics that were reported at the December meeting and these, we're also working to verify that these are all accurate. But we've also created a breakdown of the RDA count by county, so you can have a better view of what the populations are in each county to compare with the dentistry populations broken out by county. We've also completed statistics based on the license type, breaking out the applications that have been received and approved, licenses issued, and canceled licenses, withdrawn licenses, and denied licenses over a 12-month breakdown, as well as provide graphics. And again, I'd be happy to answer any questions.
So, Dr. Chan, is this what you're talking about to integrate in our enforcement report, where you see the dental assisting statistics, the raw numbers, and then graphically, this is what you're looking for? Okay, we'll make a note of that. Thank you.
I have one more question. I'll go back to what I was talking about. If it's all written, why isn't EF and orthodontic combined then? Just so we don't have so many different classifications. I think the more classification, the more breakdown we have, basically everybody's extended function, why shouldn't they learn that as well as one umbrella, instead of having so many different ones and expanding so many different categories? Because in the future, the record keeping will be a lot more. I'm just trying to streamline it for the future. If an EF also is trained in orthodontic assistant, wouldn't that be beneficial to that person? That's all.
I've just been informed that item is not agendized for discussion, so we'll have to bring that back for a future meeting, but it's a fair question. There's a lot of history here on how the dental assisting categories were reclassified, and there was a new statute, new regulations in 2010, and you could look back and see how that went together.
Okay. The reason being is I'm just getting onto this and I don't know that much about it. And
Understood.
so I'm confused of why there's that many.
There's a lot to it.
Okay.
If there's no other questions, would you like to move on to number 7?
Please.
Update regarding the review of the RDA practical examination. As you know, we've been working with the Department of Consumer Affairs Office of Professional Examination Services. We did enter into a contract with or an interagency agreement with their office to review our practical examination. They have attended our examinations and are working with staff on the review of the administration, the grade sheets, et cetera. In addition to their individual review of everything, they've also been holding workshops So at the end of January, we had a workshop where stakeholders were invited for over the course of 2 days. I think we had invited about 20 different stakeholders that were interested in participating, and they received feedback. OPES received feedback from those stakeholders. And then they also held a separate workshop for those that are licensees in the RDA profession over the range of different variables. So those licensed 0 to 5 years, those licensed more than 5 years, to get feedback on what they have to say about the practical exam as well. So we are continuing to work with OPES on this, and we hope, the contract states that the timeline, we should have a report sometime during the summer of this year. So as this progresses, I will continue to report back to the board and the council accordingly.
Yeah, we're all waiting to see what comes out of that. I think we'll have something for the May meeting on that, hopefully.
Hopefully, fingers crossed.
Well, the May meeting is going to be a week long now, so just everybody, just block your calendars. May is going to be a long meeting.
So same with agenda item 8, at the December meeting, I think it was the December meeting, or maybe it was the August meeting, that the board and the council had voted to combine the RDA written and the law and ethics examinations. Was it December? Because it seems like it was a really long time ago. I guess it was December. And so after that meeting, we immediately contracted an interagency agreement with OPES to have that review completed. And so while we're doing this combining of the 2 examinations, we're also continuously updating the law and ethics exam as well. And so we have 2 simultaneous projects going on where we have workshops that we're scheduling to keep the law and ethics exam up to date while we're working on the combining of the written and the law and ethics. And so staff has been working diligently at scheduling these subject matter experts to attend these 2-day workshops at OPES to begin the item development for these examinations. And so right now, we're hoping probably mid to late 2018, we'll have the combined test released, but the individual law and ethics will continue to be released as it has been in the past, up until the time we're able to combine it.
I just wanted to clarify for board members and council members that with these workshops that are conducted by OPES, staff's involvement really only is with regard to the travel arrangements and working with the people who participate in these workshops. So OPES, it's a very secure, essentially secured environment. They want the ability to talk to people without any influences from board, council members, and staff members. Sarah, did we talk about how OPES has attended the practical exam and will be coming back with a report soon? Did we talk about that? Okay. Sorry.
Will the report indicate the pass rate as it pertains to the filling versus the temporary crown? Is it broken into 2 categories when they'll be reporting?
So my understanding, and I'm not 100% sure of everything that they're going to be including in the report, but from what I can guess, from what they're asking for data from us, we've been providing grade sheets and grade information for them to analyze. And so I would anticipate that that would include some sort of an analysis as to the scores for each component of the practical exam. I don't know in what format that would look like, but I believe that would be part of what the report would look like.
Okay.
We got a little out of our sync here, and so I'm going to take this opportunity to introduce the person who just actually commented. This is Jennifer Rodriguez. She is the new council member coming on as an RDAEF. This is her first meeting. She came to Sacramento. We gave her the mini orientation, sent her home with a truckload of stuff to read. So when you get an opportunity, welcome her to the council and the board, and we appreciate you and are looking forward to working with you.
So agenda item 9, an update on the 2017 Dental Assisting Council regulatory workshops. Over the course of 2016, we held regulatory workshops approximately every 6 weeks. And so what we're looking for in 2017 is we've scheduled workshops with our dental assistant council members for Friday, April 7th and Friday, June 23rd to kind of finalize those discussions so that by the August meeting, we should be able to bring final regulatory language back in a formal setting of the dental assistant council and the board to consider for initiation of an actual rulemaking. And so the April meeting is scheduled to essentially review all of the text that we've been developing over the last year and a half. And then the June meeting would essentially be able to review the final text, review forms associated that would be incorporated by reference. So we have people helping us with the forms development. And then also the dental assisting fees for the programs and course applications were not included as part of our fee increase regulatory package that we're currently working on. And so what we're also going to be working on leading up to the June meeting is the workload analysis that would essentially dictate what the cost of reviewing those applications would be. And so those fees would be essentially included as part of that rulemaking. So at this point, the goal is the August board meeting to present actual language to initiate as a rulemaking.
Very good. Any board member questions, comments? Okay, thank you for your report. So this concludes the joint meeting of the Dental Assisting Council and the board. Now, it's customary at this time to ask for public comment on items not on the agenda. Okay, seeing none. Board and council member comments for items not on the agenda. Anybody want anything on for next time? We have quite a bit on our plate already, so I think it's kind of understandable. Okay.
Dr. Lai looks like he's in shock.
There's really a lot to dental assisting. I've worked on it for years, and it's very, very
We
complicated.
know you've been on it for years, so you know it all.
Good. Okay, then if I could have a move to adjourn? Okay. Very good. Okay, so the meeting is adjourned. Now we're going to move into our committee meetings. And I think we got time to get a few of these done before lunch. So if everybody could just bear with me, we'll try to get as much business conducted as we can before we move into closed session. So, Examination Committee. And I could just remind board members who are not members of this committee that they must take a seat in the audience. Only committee members can be seated on the dais.